Welcome to West London CAMHS, Children and Adolescent Services, working across Ealing, Hammersmith and Fulham and Hounslow communities. My name's Leah. I'm an occupational therapist and Head of Allied Health Professions within CAMHS. Welcome to West London. Come in to meet other members of the team.
Hi, my name is Kaya Joshi and I'm the Associate Director of Operations for CAMHS and Developmental Services here at West London NHS Trust. I've been working with the CAMHS services for just less than 5 years now, and I find that it's a fantastic place to work with lots of opportunity to be innovative and get involved in the running of our services.
Hi, I'm Asha. I work at Ealing CAMHS, which stands for Child and Adolescent Mental Health Services. My job title is quite long. I'm a specialist CAMHS practitioner. I've got two parts to my role, so I am a cognitive behavioural therapist and I'm a social worker.
Hi, my name is Simran. I'm the administrator for the mental health support team.
My name is Eloise and I'm a support worker for CAMHS Eating Disorder Service.
And my name's Connor and I'm an assistant psychologist for the adolescent team.
My name is Chris Ugochukwu. I'm a mental health nurse by profession and team manager for Ealing CAMHS based in the adolescent team. What
inspired me to get into this role is I have a brother who suffers from mental health issues. He suffered a psychosis, which is where my passion derives from, for working for mental health services.
I chose to do this job because I wanted to make a contribution to the field of eating disorders and help young people in their recovery from an eating disorder. Because at the moment it's quite an epidemic and I wanted to feel like I could make a difference to what we're seeing at the moment.
And I chose to do what I do because I think mental health is extremely interesting and I think there's a lot to learn about it. I think particularly within adolescence there's a lot that can kind of go wrong with mental health, so being able to help young people and particularly adolescents who are struggling with their mental health is something that I am very passionate about and really wanted to work in.
So here at West London CAMHS we have lots of opportunities to get involved in transformation, which we focus on co-producing with staff and our service users. In the coming year we're planning to move towards the Thrive way of working, as well as changing our model of working towards pathway focus to better serve the outcomes needed for our children and young people.
A day in the life would be coming into the office, liaising with colleagues, doctors, psychiatrists, patients, parents, and it's really great, it's very fun. I'm a very sociable person, so I really do enjoy that.
So one of the great things about working here at CAMHS are the people that I work with. I've got a really supportive team, but also outside of that I've got lots of people that I can go and speak to and I feel really well supported by. In terms of the other aspects of my job, the main part of my job is working with service users, and I really love feeling like I'm making a difference to all the young people that I'm working with, and also the fact that my job is really varied and no 2 days are the same.
Best bits about my job is feeling like you can make a difference to someone's life with an eating disorder.
And the best bit about my job is working with a family or with a young person and seeing the change that happens over time when we've worked with them, when we've done a good piece of work with them and seen them improve. And just kind of being able to know that you are a part of that. We
have a big focus on training and development here at the Trust, with lots of opportunities for funded CPD courses, as well as having our internal training and progression pathway recognised by the HSJ, having been nominated for an award this year.
In terms of career progression, I think that we're really good at doing that here. I've been here for a year. In that time that I've been here, I've been progressed really quickly. I think that people here are really good at recognising your talents and really showing what it is that you're good at, but also when people recognise it and other people helping to promote that too.
Here at CAMHS there are lots of ways in which you can progress your career. I personally am going down the route to become a child and adolescent psychotherapist on the team, hopefully, and they're supporting me to achieve this.
And in terms of career progression, I'm looking to go down the clinical psychology doctorate route, and my team are really helping me to develop the skills and the techniques and stuff that I need to be able to get onto that doctorate and progress my career.
I've been involved with a lot of quality improvement projects focusing on improving the experience of service users in using CAMHS, specifically about making sure that people are able to access services in a timely manner, rather than being on the waiting list.
In focusing on staff development, we've also had a more detailed look at equality, diversity and inclusion, and we're really pleased to say that the staff that we employ represent the diversity of the populations that we serve.
In terms of the social aspects, we do work very hard, but we also make sure that we spend time getting to know each other, so we organise lunches whilst we're here and whilst we're working, but also outside of work we will make sure we go and do catch-ups at the pub, or we will organise things outside of work. So we recently got funded to have a wellbeing fund, and some of the teams went and did things like axe throwing and organised lunch outside of work to do as well.
I had opportunity to observe my colleagues living a fulfilled life because of that ability to support people, that they're really happy to be able to do that in comparison to other professions.
So here at West London CAMHS, we're trying to develop a culture where we work collaboratively with our service users and our staff to develop services and systems that can manage the sheer demand and work towards better outcomes for our service users. If you're new to CAMHS, newly qualified, or just looking for your next challenge, we look forward to hearing from you as your next opportunity may be with us. Please get in touch.